Hi, my name is Edenia Rastegarpour. I am an RN and currently enrolled in the RN to BSN program at Point Loma Nazarene University. The topic I picked for my research study was the effective ways to minimize ventilators-associated pneumonias in ICU patients. So my clinical problem that I presented is that ventilators-associated pneumonia is one of the most significant problems in ICU patients, lengthening their hospitalization stay and recovery. Ventilator-associated pneumonia in an ICU problems associated with 27% of nosocomial infections in the U.S. according to Coyne et al. In 2006 research. Ventilators-associated pneumonias occurs after the 48 hours of intubations, and one of the most devastating outcomes is death in the ICU related to ventilator-associated pneumonias. There is a chance that as high as 50% that deaths are related to VAP in the ICU. The increased cost of treatments and hospitalization is another major problem. The current interventions are good, which is intensive monitoring of patients, initiating a mechanical ventilation, straight aseptic techniques, and continued training for nurses, continuous oral hygiene, and repositions and mobility. My PICO question was, in intensive care units, patients with ventilators, what is the effects of providing oral care with chlorhexidine compared to normal saline on the prevention of ventilator-associated pneumonias in the ICU settings? So since there is still a high risk of getting ventilator-associated pneumonia in the ICU, I decided that what if we add the chlorhexidine into the oral care hygiene as a prophylactic antimicrobial? Will this have any effects on the prevention of ventilator-associated pneumonia? So when I did the research, the first thing I picked, one of the words was chlorhexidine. The other ones were healthcare-associated infections, ventilator-associated pneumonias, oral care, ventilator-associated health risk, pneumonia health risk, and ventilator-associated pneumonia preventions, ventilator patients, and ventilator weaning and ventilators protocols. My limitations or parameters were peer review articles only, full text only, and English language only. My database that I used most was the CINAHL Plus, and then I also used ProQuest answering Allied Health Sources and Medline with full text. Interventions where prophylactic chlorhexidine could be effective in the prevention of VAP in the ICU. However, infection control measures has to be included as well. So although we are using the chlorhexidine, we also have to always keep the sterile techniques in mind to prevent the VAP, the ventilator-associated pneumonias. And in addition to use the prophylactic chlorhexidine, the mechanical activity of brushing the plaque away from the teeth could be most effective in the treatment. So after doing all my research, I also find out that they discovered that this could be also effective, that even if you don't use the antimicrobial defined, but this study is still under investigation. And then for data collection, the organizations could collect the data by monitoring the patients diagnosed with VAP in an ICU 2 days after ventilation is applied, monitor radiographic studies, and report patients' data with the VAP 2 days after the ventilation was applied, monitor labs and sputum culture for patients with suspected ventilator-associated pneumonia, and monitor pharmacological data for patients that receive antibiotics during the ventilation periods for VAP, and that also could include chlorhexidine, which is an antimicrobial. And then monitor the outcomes of patients that receive oral care with prophylactic chlorhexidine. And I found 5 articles that were systematic review, meta-analysis, or research finding. Thank you. I hope you find it interesting. And thank you for listening to my presentation on ventilator-associated pneumonia. And I hope that this one decreased, because the purpose of having our patients on ventilators on the ICU is to bring them back and restore their life, not to prolong their stay or worsen their status. So I hope we can prevent this so that our patients don't get nosocomial infections in a place that they should be safe.